What's up, guys? Welcome to the Fearless Fitness Academy YouTube. My name is Steven Chinos, registered dietitian, on Instagram as Steven the Dietitian, and this is my first ever long form video on YouTube. I wanted to kind of celebrate the launch of this long form content with a little mini series, okay? This is titled Lab Tests You Should Ask For at the Doctors and How to Improve Those Blood Markers. I recently got some blood work done. I'm a registered dietitian, so I figured this is great to kind of explain how diet, exercise can influence those blood markers. Even if you don't lose weight, making significant changes to your overall lifestyle can substantially help you improve those blood markers. So if you've gone to the doctor and you've had some blood work done and they told you that you have high blood pressure, high cholesterol, high triglycerides, you're pre-diabetic, then this is the video for you. In this specific video, we'll be covering the lipid panel, okay? The lipid panel, which involves the cholesterol levels, your HDL cholesterol levels, your LDL cholesterol levels, and your total triglyceride levels. So without further ado, let's hop right in. Did you know that losing just 5 to 10% of your total body weight can substantially help you improve those blood markers? So that means if you weigh 200 pounds, losing just 10 pounds can improve your A1C, your lipid panel, your glucose levels, and you'll feel so much better. This doesn't mean that you have to lose weight. Sometimes weight loss isn't just about good looks. It's about feeling good inside. It's about improving your internal health so that you prevent an early death from preventable diseases. Because as a registered dietitian, I work at a nursing home as well, and time again, I visit patients that regret the decisions they've made so far and regret not taking action on their health when they were younger, when they were healthier. So let's talk about the lipid panel, okay? Again, like I mentioned before, the lipid panel involves a test of your total cholesterol, a test of your high density lipoprotein or HDL, low density lipoprotein or LDL, and your total triglyceride levels. And let's hop into each one real quick. But first, let's kind of go over why we should even care about this test. A cholesterol test can help you determine your risk factors for cardiovascular diseases that can ultimately lead to a heart attack or a stroke. This test determines the risk of fatty deposit buildup or plaque within the arteries that nonetheless narrow those arteries and lead to atherosclerosis or hardening and narrowing of those arteries. So of the 4 tests within a lipid panel, let's go over total cholesterol. Total cholesterol is simply that total sum of your cholesterol in your blood. Your goal is to be below 200 milligrams per deciliter of blood. And because I want to be really transparent, my results for total cholesterol are 162. I'll talk about ways to improve this later on. But first, let's go over the next test in this lipid panel. LDL or low density lipoprotein. In other words, the bad cholesterol. It's the LDL that is of concern. Too much of this bad cholesterol, LDL, causes fatty acid buildup deposited in the arteries, causing that narrowing of those arteries, which lead to atherosclerosis. As the fatty deposits build up, they harden, and over time, these fatty deposits can rupture. And when they rupture, these pieces of fragments can travel to the heart or it can travel to the brain, which ultimately cause a heart attack or a stroke, simply because they blocked the flow of blood. Your goal for this test is to be below 100 milligrams per deciliter. For full transparency, my results were 80 milligrams per deciliter of blood. So I'm pretty good. Moving on to the third test within the lipid panel, HDL or high density lipoprotein. In other words, the good cholesterol. This is what you want to have more of. HDL is the good cholesterol because it actually helps carry away the bad cholesterol known as LDL. So when we have more of this good cholesterol carrying away the bad cholesterol, we're in a good spot. We're not prone to those heart attacks or those strokes. A goal in mind is to keep your HDL above 65 milligrams per deciliter. On my test, I hit 73 milligrams per deciliter. So that's pretty up there. That's above 65 milligrams per deciliter. And finally, let's talk about the 4th test, triglyceride levels. Triglycerides are a type of fat in the blood. When we eat, your body turns unused calories into triglycerides, which are then stored as body fat. High triglyceride levels are correlated with high blood sugar, obesity, being overweight, eating too many sweets, so eating a lot of added sugars, drinking a lot of alcohol, smoking, and being sedentary. The goal for triglycerides is to have them below 150 milligrams per deciliter. My value, which was very surprising to see, was 43 milligrams per deciliter, okay? You want to have it under 150 again. So those are the 4 tests within a lipid panel that you want to be aware of. Now I want to talk about how to improve those blood markers if you find yourself with high cholesterol, high LDL, low HDL, and high triglycerides. If your results show that you're in an unfavorable situation, don't get discouraged, because you can get these improved, alright? And it's going to involve you changing your lifestyle, improving your diet, exercising more, and being intentional with your way of life. And if lifestyle changes are not enough, then going the pharmacotherapy route would be a choice for you. How can diet influence our lipid panel? Well, let me talk about it, okay? This means that you're adopting a way of eating that's very minimally processed. So you're choosing more whole foods instead of processed foods. So this means that we're eating more fruits, we're eating more veggies, we're having more whole grains, we're choosing low-fat or fat-free milk and dairy products. We're choosing poultry, lean white meat, so like the chicken breast, turkey breast. We're choosing lean red meat instead of fatty red meat. We're choosing beans and nuts on our meals or as snacks. And we're choosing vegetable oils or olive oil in place of butter. And most importantly, we're limiting the sweetened beverages. We're limiting the sodas, the juices. Have your Diet Coke. It's not going to kill you. It's even better for you, actually, if you're trying to lose weight. I actually have a free guide on the types of red meat you should choose from when at the grocery store, and I want to give it to you for free. Just hit the link in the description below and I'll send it right over to you. Did you know that simply replacing your butter or your ghee or your coconut oil with olive oil, avocado oil, or even vegetable oils can significantly reduce your LDL and your total cholesterol? There's a caveat though. Just because you're eating fries that are cooked in peanut oil doesn't mean that it's going to work for you. Calories still matter. The most important thing for improving these blood markers is what's your diet looking like and how's your overall lifestyle looking like. So this means you're being intentional about getting those steps in. You're going for that daily walk that lasts about 20-30 minutes. You're lifting weights intentionally for a minimum of 2 to 3 times per week. You're drinking enough water every single day. You're filling up your bottle of water and consuming about 130 ounces every single day. You're managing your stress effectively. You're getting to bed on time and averaging a minimum of 7 hours per night. You're intentionally limiting alcohol to 0 drinks per week, not smoking at all, and getting off that damn couch and getting active. This also means you're cooking at home most days of the week and intentionally adding that salad to your dinner and your lunch. There's a question I always get. Do eggs increase your cholesterol? Short answer, no. It depends on your genetics though. But they don't seem to increase that cholesterol unless you have a very poor diet, which most Americans do. For many people, moderate egg consumption and even an excessive egg consumption is perfectly okay and even permissible and beneficial for preventing heart disease. As long as you have an overall healthy diet, lifestyle, which incorporates lots of exercise. You guys, I hope this video is of great help. Be sure to send this to someone who may need more education on the topic. I want to tell you guys that change is hard. Incorporating all of these things is hard, but start small, start now, because I don't want you regretting the decisions you made leading up to old age. Comment below what other topics you want me to cover. Be sure to subscribe for more nutrition and fitness content like this. I'll see you guys on the next one.